So before you receive treatment, we would have done a scan of teeth there, so we can simulate all these movements that are coming up, and then the lab would make these clear aligners, a series of clear aligners, and each of them is just slightly different to the other. That incorporates all these movements step by step, and you just kind of go through these aligners. Usually each aligner will last you for 1 week at a time, and then you move on to the next one. As you go through the whole series of aligners, we can perform all these movements that we plan to do. So no, it's actually quite subtle, except like for myself, I see patients every day, then I might notice their teeth have got something going on, but no, for most people they would not be noticeable. Yeah, so you can still enjoy food there while you're having aligner treatment. You obviously would have your aligners out when you're eating, and you want to limit the amount of time when your aligners is not in your mouth, up to 30 minutes each time. Drinks wise, if you're just drinking water, you can keep your aligners in, but if you're drinking anything else, you might want to have your aligners out, and you want to make sure after you eat and drink every time you will be brushing your teeth and flossing as well. It's just important that you're clearing all the plaque away, especially while you have aligners treatment, because you would have increased chance of having gum problems if you didn't do so. There's going to be some very mild discomfort because at the end of the day we're moving teeth. Thankfully with the aligners, compared to other methods like say train tracks, the discomfort is much less. Because these forces that's generated by the aligners, they're much more gentle. It's just going to be very mild discomfort being expected. Well, I wouldn't be expecting anyone needing to take painkillers for anything like that. So usually want to change your aligners once every week. That's the average speed that most people would go at. And for the number of appointments, it depends on how many aligners are required in your treatment. So usually there's going to be a review appointment every 4 aligners. So that means every 4 weeks you'll be seeing your dentist, and they'll be monitoring the tooth movement, monitoring for any other issues that might be emerging, so like gum disease. Well, it depends on how many aligners you have, then that determines how long your treatment's going to take. So you want to wear them for at least 22 hours a day. Aligners work is like pushing a boulder up a slope there. So as soon as you stop pushing, the boulder is going to start rolling back down the slope there. So you want to basically push as much as you can for as much time as you can per day. So 22 hours per day, that takes care of time that you need to be eating, time you need to clean your teeth for. So that's a realistic sort of wearing time per day that we're expecting. These progressions are going to be quite gradual. You probably start noticing changes there maybe about at least 3 to 4 weeks time there. You start to notice things are changing there. Maybe certain teeth are starting to face a slightly different direction, and if you've got any further prominence of teeth there, the angulation might change slightly differently. But yeah, usually I would say 3 to 4 weeks you start noticing a difference. So you want to clean them under tap water and hand soap, and it's also a good idea to use some of these ultrasonic bath pods, which we actually do provide our patients with when they come in for Invisalign treatment. So that's the best way of keeping your aligners clean and clear when you're using them. So after you finish your aligner treatment, congratulations, you've got your nice smile. But then the commitment is that you would want to wear a retainer pretty much for life. So by that we mean like you would be committing to wearing that every single night, and for as long as you want your smile to be perfect, then you want to be using your retainers. So aligners are more focused on correcting like minor alignment issues. It wouldn't be suitable for fixing severe bite problems, which usually involves back teeth, but they're really good for correcting the angulation and the crowding for the front teeth if they're kind of within the mild to moderate region.